From the Asgard Company Studios in beautiful Wichita Falls, Texas, from the finest mind in the modern fitness industry, the one true voice in the strength and conditioning profession, the most important podcast on the internet. Ladies and gentlemen, starting Strength Radio. Welcome to Starting Strength Radio. It's Friday. It's not Saturday. It's not Monday. It's not Tuesday, Wednesday, Thursday. It is Friday. And Friday is the day that Starting Strength Radio brings you the cutting edge in all matters: strength training, social, sexual, alcoholic, and everything else of any interest whatsoever. And we are here today with our friend Matt Briggs. William M. Briggs is the statistician of the stars. Those of you that are on the internet have seen him and read his material with interest because the man is good at this. He is an excellent explainer, and he's a lot of people realize this, and he's linked to from all over the internet, and we're happy that he is with us today. Briggs, thank you for being here.
Oh, thanks for having me.
We are going to talk about COVID-19 today in the presence of an expert on the statistics, the actual data, not the bullshit that you have been delivered on the broadcast networks and over most of the internet. We're going to talk about the actual data. And the actual data tells a completely different story than you are familiar with. And it's extremely important that you understand this, because your actions should be governed by logic and analysis. And without the data, you cannot perform the analysis, even if you are logical. The data are extremely crucial. The data have been withheld from you because, in my opinion, there is an agenda in operation here. And this will, of course, get us defunded from YouTube for this episode, won't it? Probably will. Hey, we got all kind of money. We got lots and lots of money, so we don't need it. But I wish they'd leave it up so people would learn.
Leave it up, we just won't get paid for it.
Yeah, well, that's fine. As long as they leave it up, it's fine with me. Before we get started, you guys get this. Okay, this is Briggs' new book, written in association with Douglas Axe and Jay Richards, The Price of Panic. It is on Amazon right now. And a lot of the stuff we're going to talk about today is written down for you here in the book. And my advice to you is to place an order for it right now. And have it with you and read it and let all this stuff sink in, because it's terribly critical that you deprogram yourself. Briggs, what exactly the hell is happening around us? Because it's difficult to organize. It's difficult for a logical person, a person that likes for things to fit into a logical framework, to look at what is going on around us right now and not go completely insane because of the irrationality of every single action that has been taken by every level of government at every step of this process. It started back in February to right this minute. It doesn't make any goddamn sense. And it's just, I know you're under as much stress as everybody else is. You know, you get up every day and you go outside and you see people riding down the street by themselves with a mask on a motorcycle. You see people in cars by themselves with a mask on. You see all of this insane, illogical, irrational shit taking place, and it just, it just challenges your ability to remain, out of jail. What the hell is happening here?
You see people running, jogging on the East River. The East River is a very popular thing to jog on. It's a sunny, beautiful, warm day. These people are young, 30s, spit, seemingly, and they got masks on in the heat. We're jogging. It's beyond belief. And they see someone like me coming because I'm not going to wear a mask.
I'm not going to wear one. I don't own one.
Because they don't want to be infected. They're sure the air is permeated.
It's like
with this
yes,
deadly.
they think that the virus is wafting through the air like smoke.
That's it. That's exactly what it is. It's in New York City at the beginning of this April when it was at its peak. And people were dying like they do every year of flu and other seasonal diseases, mainly pneumonia. Masks weren't that big a deal. People were wearing them, but not very many. Now
that it's over,
dropped to zero, almost zero, in the entire state. 95% or more are wearing masks.
Yes.
Now, it's true the godmother, the governor of New York, is mandated their use in buildings and all this kind of thing. But there's no reason to be doing this when you're sitting, like you say, they're driving down the street in a motorcycle, they're driving in their car, they got the windows up and they're wearing a mask. They're walking on a beautiful sunny, the air is germicidal. Healthy fresh air is going to kill germs. The sun,
UV.
The sun kills germs.
UV kills germs.
Listen, let me ask we're going to probably talk about this many times, but I want to ask all your listeners. They already know the answer, and you and I talked about this the other day. Why is it that every year, right about starting at this date until February, March, do we get a peak in flu and pneumonia deaths, whereas in the summer they drop off to nothing? Now, everybody knows the answer to this. That's because in the winter months, we all cram each other in these self-enforced voluntary lockdowns,
right,
spreading the disease amongst ourselves. And unfortunately, people get it. They get the flu, and they develop pneumonia. A lot of people die from this every single year. Even if we have vaccines, we've had vaccines for half a century now. That's not stopping flu deaths. But let me ask this question. So we know that this is the case, and then in spring, of course, people start to get back outside. They get out into the sunshine, and these diseases drop off, but never fade away. They just drop off.
Right.
So what was the solution? I'll put that in air quotes. What was the solution the government hit upon to stop the spread of the corona doom?
To keep us all trapped inside with each other so we could transmit it to each other, so that we wouldn't transmit it to each other.
It's exactly. It's absolutely.
It's insane. The whole thing is completely insane.
If you had this in the old days, if you got on the high seas, we were talking about the O'Brien, Aubrey Maturin novels. You have a ship that's infected with yellow fever, and you have a isolated, perfectly isolatable vessel that you can keep off into the water. And the virus is raging through. Back then, there was no inoculation for the yellow fever. And, of course, it makes perfectly eminent sense to keep those people absolutely isolated from the rest of the population.
Right.
But in a lockdown, you can't do that. You have to have people are still going out to the grocery store. They're going to whatever the government deems are, quote, unquote, essential businesses. So people are still mixing.
Yeah, to look at the thing conversely, if you were on a ship at sea and there were no diseases on the ship and there were no inputs from external to the vessel, the ship was fine. You've got thousands and thousands of miles of salt water around you, and there's no vector for anything to get aboard the ship, and all of those guys stayed healthy. Hell, it was rather uncommon to have an infected wound in a situation like this out there in the ocean, and people but what do we do, in response to this ridiculous little flu virus, Corona 19? We decided that everybody that was sick, and especially in the state of New York, everybody that was infirm had to be exposed to the coronavirus by having active cases pumped into the nursing homes, and killed 10,000 people. you know.
the latest estimate, yeah.
Yeah, 10,000 people. Andrew Cuomo is actually a mass murderer, but he'll never do it. He'll never see the inside of a jail for that because that's not what we do here in the United States. We don't put our political class in prison. We used to hang them. You know, in a more gentle society, we hung them. That's what lampposts were for. You know, but now we have to just sit here and take this.
Now these lockdowns, the WHO, the World Health Organization, just by coincidence, released this major report last year in 2019, before this pandemic hit, and because we get these pandemics every 10 to 20 years, all right,
yes.
We get them routinely.
Yes.
We had
it's normal,
which killed maybe up to 600,000 people worldwide, but no panic. We had the bird flu before that. We had the Hong Kong flu back in 67, 68 that killed about the same number of people they're saying the Corona doom killed right now, about 1 million. And in 57, we had the Asian flu, which killed about 2 million people. And that was at a time when there was about a third fewer people across the globe. So that was a much deadlier killer.
Much.
But no lockdowns, no panic, no unreasoning, irrational rush to stop anybody from dying. I think that's if there's any one thing that happened here is that the public, driven by media with these asinine headlines, panicked.
Right.
The people panicked. They demanded the government do something. And what better message to give the government than they're needed? That they need to actually go out there and start making up these new rules and restrictions and
absolutely.
Stuff. And they jumped at it. And once they did that, they could not admit that it was wrong. And they're going to stick with this kind of stuff.
No, so they're staying by their story. There's no doubt.
Exactly. There's nobody's going to pay a price for this.
No.
No chance.
No, that doesn't occur in 2020.
At all. So what we want to do is we want to stop this from happening a second time. But unfortunately, it looks like we're entering phase 2 of the panic right now. And the reason we're entering phase 2 of the panic is testing.
Yes.
Testing.
I was listening to saw a lecture this morning by Michael Yeadon, Dr. Yeadon from the UK. You probably have talked to him about this. And he made the point, the very good point, that the natural history of any virus is detailed on a graph by what's called the Gompertz curve. And that under especially coronaviruses that don't mutate very quickly, there is no such thing as a second wave. It doesn't occur. It's biologically impossible. Yet, we are creating what the media and the government are referring to as a second wave by testing. So let's get, this is really a terribly critical thing here. That the government and the media have created quite a bit of terror here. And people who are afraid will give the government power that they wouldn't, under normal circumstances, cede to the government. And what is going on right now is that the government is manufacturing fear and promising at the same time to protect us through their actions. In other words, through making us do what they want us to do, which are interpreted as their actions. And as a result of that, we are supposed to all become safer if we just cower in fear under our kitchen tables with our masks on in plastic bags. And this not only ignores the fact, and this is a separate issue we really need to talk about, that this disease is just not that deadly, but that the case rate that we are now supposed to be afraid of, not the death rate, but the case rate, is being manufactured by the testing rate. And I'd like for you to discuss that at length, because this is, people have to understand, case rate is what do you mean by the term case? What do they mean by the term case?
Before 2020, every medical professional knew the difference between an infection and a case. An infection was a person like yourself who may have got a cold or something like this, just an infection that did not require treatment or hospitalization.
Right.
Or the person with the infection never went to the doctor and sought treatment. Most common colds are like this. Most small infections are just that way. They're infections. We used to speak of an infection fatality rate. Those are the people who got the bug and who succumbed. But it was always an estimate because we never really knew the exact number of infected because these people were just not showing up to the doctor.
That's right.
A case was a person who did need either hospitalization or required some kind of a treatment. And we would speak of case fatality rates. These are necessarily higher than infection fatality
Obviously.
rates. Because these are the sick people. These are the people who are showing up and really need treatment. Of course, that's going to be higher.
The people we have identified as being sick.
Absolutely.
But we see signs and they have symptoms and they are recognized to be infected.
Yeah, that's right. So the media can't distinguish these two at all. They mix up infections and cases, and everybody just follows suit with this, and the government took up that mantle. Because when you hear case, when you hear on the radio or TV or something like this, you hear there's been 10 new cases on some football team or whatever. You think, oh my God, these people are on their way to being hooked up to a ventilator. They must be,
Right.
That's the only images that you're presented with. That's absolute nonsense.
It's 10 cases in 23-year-old professional athletes result in how many deaths? Exactly how many deaths?
Small symptoms on this. There's a large number of people, particularly the young, who are asymptomatic or have very minor symptoms. I myself had, back in March, I had for not even quite a day, I had a scratchy throat.
Right.
Okay, fine, whatever. So, but it's nothing to worry about for most people. We've already seen that. Now, but what this means is this. Back in April, there were a large number of people dying, both from caused by the government lockdowns and from this new disease. It's true. Mostly elderly people who are very ill were dying. We'll talk about that. But testing had nowhere moved to the general population. It was just those people presenting at hospitals and the exceptionally nervous who showed up to be tested.
Mm-hmm.
Testing has since ramped up.
Testing is an industry now.
For 1 million tests a day now. 1 million tests a day. And deaths have dropped down. They're never going to go to zero. Okay, that's one thing. We'll talk about that too.
That's an interesting thing about human life, isn't it?
Yeah. But testing is over 1 million a day now. And this PCR test, which is the most widely used thing, is very sensitive. It's reporting a lot of infections, which the media are calling cases. And a lot of these are either past infections, indications of other coronavirus. The coronavirus causes the common cold. This particular one is a mutation of it, and it causes deadlier diseases in some. This is picking up very small asymptomatic cases. And in a lot of cases, it's picking up no case at all.
No, it's picking up little fragments of the virus.
No, not even that. It's picking up nothing and calling them viruses.
Right.
There's one study I saw about 1 to 4% false positive rate. That doesn't sound bad, all right? The test is good if it's 96% accurate or something. But when you're doing 1 million tests and you have a small prevalence of the disease, you're going to have thousands and thousands of people a day who are falsely labeled as being infected or cases.
And I want to talk about this in some detail because people don't understand the statistical issue here that is the result that arises from a false positive rate. Without going into a lot of detail, the polymerase chain reaction test was developed by Kerry Mullis back in the 80s, and it's very, very good at amplifying little tiny nano quantities of substances that are available in a sample so that we can identify their presence. But if you run a PCR test and you repeat the test through 40 cycles, for example, the thing starts showing you shit that's not necessarily there. And this is just the PCR test is very, very important for lots and lots of things. But used under these circumstances, it throws a bunch of shit data out. Now, we all know what a false positive test is. But if you've got a false positive test rate of 1%, you've got a problem. And I want you to explain to the lay person exactly why that would be. Because it's important to understand this.
Obviously, if you're doing 1 million tests, now, without getting into the math, it depends on the actual prevalence of the disease in the population. And by now, a lot of us have been infected. We're reaching herd immunity. So the active infections are probably pretty low. So there's a bit of math involving the actual prevalence and the false positive rate. But it's easy enough to see. If you're saying from 1 to 4% of the sample that you're doing have the disease and they really don't, and you're testing well over 1 million a day, you're going to end up with thousands of people who are said to have the disease and do not.
Yeah, 10 to 40,000 people who like you said had the disease don't actually have the disease.
It's not like these people are actually being then treated. And so you never hear this part in the media. All you hear is the number of positive tests, which they're calling falsely cases. And so you think something's happening with these people. This is not the case at all. Many of these people are going, a lot of people are being tested daily, and they're all included into this thing. It depends on which job they have and this kind of a thing. There's lots and lots of people. There's people who are already infected, known to be infected, genuinely have the disease at some low level, and they're being tested multiple times. Which is rational if you're in the hospital and so forth, and you want to check the progress of this. But they're being included in these totals.
Every time they're tested, they're counted as a new case. The same person.
It's just some people are trying to be careful about this, but the media is not trying to be careful about this. They're trying to do anything they can to juice this panic along because it gets them eyeballs, and that sells them ads, and that's all they really care about. Plus, they want to be seen as important and influential. That's no small thing either.
Right. So if you've got even a small rate of false positives, and every test is going to generate some false positives, but under normal circumstances, we don't make policy based on false positives. But in this particular case, we have. We've made public health policy based on false positives. So if your false positive rate is 1 to 4% and you've conducted 1 million tests, you generate a tremendous number of cases that aren't actually cases. And then you make policy based on that. And I mean, if you want to go through under a normal, disease situation under which everybody's behaving rationally and stuff, and you want to conduct a bunch of tests to do some epidemiology and stuff on this, I don't guess it's a problem. But if you are locking down the entire population of a state as a result of what you call a spiking case rate, which is 100% the fault of the testing rate, not the infections, then this is a giant problem that no one has ever had to deal with before. And
exactly.
I can't impress upon people how.
So why don't people, medical professionals, know these facts?
Sure they do.
So what do? They emphasize the other side of things. If there's false positives, there can, of course, be false negatives. These are times people have an infection, but the test didn't pick it up. Now, this is true. There is about the same percentage rate of false negatives for these tests. But, so they base policy on the better safe than sorry rule, which is, of course, the absolute dumbest thing you could do.
That's how you destroy an economy.
Right. If these false negatives are that's true. They're false negatives. These people have the infection, but they're not sick. All right.
Right.
So if you're going into the hospital and you're gasping for breath and you got a temperature of 103 or 4 or something like this, and you lost your taste of smell, but somehow the test comes back and says, "Sorry, you don't have the." They're not going to kick you out.
They don't send you home. You're sick.
The tests are missing. The tests are missing the people who are healthy or just have a bare asymptomatic infection.
Right.
The younger people who have no comorbidities and stuff. So they're making policy based on that, and not on the harmful false positives. It's absolutely inverted from normal procedure. Because, I mean, we wrote in the book. I went through a flu scenario. Imagine if you started hearing these numbers in October. We had so many new cases. They're building every day, and then the deaths start being reported. More and more deaths, and oh my God, the people are going to panic, and we could just juice this panic just by reporting the normal flu deaths. In 2017-18, about, depending on how you count, 180 to 200,000 people, 180 to 200,000 people, Americans, died of flu and subsequent pneummonia.
Right.
Now,
and here we are with supposedly 220,000 deaths from coronavirus 19, from COVID-19, which is the same thing as the flu. It's exactly the same thing.
It's a different bug and everything.
But it's a different bug. But in terms of the mortality, it's the same exact thing. It's the differences are trivial. People are dead. A whole bunch of people are dead. But every year in the United States, 2.9 to 3 million people die. In terms of the population percentage, this is a little bit less than 1% of the population every year in the United States dies. That's what happens. But we have now decided that because someone might get sick, we have to take all these bizarre, extraordinary steps to prevent from happening that which is going to happen anyway, right? And it's...
Not only that, listen, between every week of every year, all the time, without any possibility of stopping it, of all the weekly deaths, 5 to 12% are flu and pneumonia. It peaks, of course, in the winter and goes down to 5% or so in the summer. It doesn't disappear. It never disappears. This coronavirus, like all the other coronavirus, is never going to disappear. It's just going to be added to the mix of all of these things that are out there and kill some of us.
That kill people. Things kill people, right?
We've adopted a zero tolerance policy on deaths, and it's never going to happen.
Well, it is interesting, isn't it, that we seem to be reluctant to understand that we are undertaking a war on death that cannot be won any more than a war on poverty, a war on stupidity, a war on sex. Some things can't be won with a war, and this is one of them. Now, if you want to prevent death, what the hell are you going to have to do? Well, you're going to have to make everybody stay at home, never leave their house, and you're going to have to drop the speed limit to 5 miles an hour for those necessary vehicles that are driving around patrolling the streets for people outside without wearing masks on to 5 miles an hour. Speed limits are an excellent analogy here. They're very, very useful. When the national speed limit was 55 miles an hour back during the Nixon administration, and finally, the only logical thing that Bill Clinton ever did was raise the speed limit, eliminate the national 55 miles an hour speed limit, and I'll drink beer with him for that, all right? He didn't do everything wrong. But we have decided, at that point, that even though we know that for every 5 miles an hour a speed limit is increased, there will be a certain measurable number of additional deaths associated with a higher rate of speed. And there are highways in the United States. There's an 85 mile an hour speed limit for a section of Interstate 10 out in West Texas, where there's nobody there and the road is straight. 85 miles an hour. Because as a society, we have decided that the convenience of rapid transit and saving time on the highway is we have done a risk assessment, risk benefit analysis on it, and have decided that, if we're out there, 85 miles an hour is fine. 75 miles an hour is just fine. 55 miles an hour costs us too much in time and money. And that is directly balanced against lives. Yet, nobody goes ape shit when you suggest that me driving 80 miles an hour down the highway isn't that necessarily that big a deal, right? But
and let me tell you, the number of deaths, I think it's like 800, roughly on average, 800, I believe that's correct, a week die in traffic fatalities in the United States. And we're below that level of the corona doom deaths or attributed deaths. And that's, at least when they die in a traffic accident, we know that it was the car crash that killed them.
You see the brains and the blood and the broken bones and the fragments of hair and teeth and shit, and you know that the impact actually killed you. Whereas death data in corona, now let's talk about that, because that's a precious little thing, isn't it?
It's a mess. Now, look, so you have here's a typical patient I saw the charts on. 82-year-old black woman, Alzheimer's, CAD, coronary artery disease, and diabetes.
Right.
And also she had the corona doom and died. Okay. So what do you put on the death certificate? You put Alzheimer's. You got to put something. You got to put Alzheimer's. You're going to put CAD. What are you going to put? Diabetes, or are you going to put something that's going to get the hospital a little bit extra money because they're being paid for these?
Because they're being paid for those death notices, aren't they?
You got to put something, and it's true that without the coronavirus, this woman probably would have lived a couple of more months, possibly. So this woman, what we see here, it doesn't. You look at whatever age bracket you want, the risk of dying from the coronavirus, the population fatality ratio, you never hear reported.
No,
that's the only one of interest to everybody. You take all the number of people alive in an age bucket, and you take the number of people who died from whatever cause, coronavirus included. You divide those numbers, and it's extraordinarily low until you get until about, depends, about 75, 70 years old. And what we have discovered this year is an amazing fact. Old people die at higher rates than young people.
That's fascinating, isn't it? What a revelation.
No matter what age you're in, you still have at least a 10 times more chance of dying from something other than the coronavirus. Even these most elderly people, even the 85-plus-year-olds, still have a 10 times higher rate of dying from something else. So we have a huge problem now of deciding whether people are dying with or from this disease. Now, the CDC earlier in the year did a study in which they discovered only 6% of the figure you're hearing of the number of deaths died of the coronavirus exclusively.
Right.
6%.
6% of 220,000 is, that's about 6,000 people, right? 7,000 people, something to that effect?
Double that.
So 12,000 people.
Yeah. All right. So, but and all of
you're the statistician, thank God.
That's
so
right. That's close enough.
Yeah.
But these were all elderly people, very elderly people. And
right.
It's sad and everything. And I'm sorry, but we can't eliminate death.
Do you know? Do you happen to know right off the top of your head what the average age of death from coronavirus is?
It's something like 74 something.
That's the average age of death. And what is the average mortality, the average age of death in the U.S. population?
I don't know that. It's up around the same thing. It's not exactly the same, but pretty close.
They're essentially the same number.
Essentially the same number. And the reason is this, is because in that same CDC study, 94% of those people had on average about 2 to 3 comorbidities. serious comorbidities like Alzheimer's,
Cancer,
like diabetes,
COPD,
like COPD, like asthma,
type
cancer
2.
is the one.
Right.
These people were sick people.
These are people
Sick
who are
and
dying anyway.
They were in nursing homes. The toll in nursing homes was, of course, tremendous, terrible. But you got to remember, nursing home, the fatality rate of the exit from nursing homes is pretty high.
Yes.
So it's a terrible thing and everything, but this is not unexpected. Okay, it's still the case that if you're young, say less than 60, and you don't have all these comorbidities, you're absolutely under extremely tiny risk. Extremely tiny. You have a much higher risk. I guess it was under 18, you have like a 600 times more chance, 600 times higher chance of dying from something else.
From a car wreck.
Car wreck, anything.
But you don't give your keys to your mother, do you?
Suicide is bigger. And
Right.
Suicides have gone up. They've doubled in some places because of these lockdowns. People lost their businesses. They lost their livelihoods. They've lost hope. They buy into this panic stuff. Suicides are up everywhere, not just here in England.
All over the
in
world.
France, all over the place where they thought these lockdowns were a good idea against all evidence. And so that not just that. It's not just that. It's very difficult to tease all these statistics out, but the number of other deaths are also up. We have in our book, we have some examples of people who, for instance, a woman had a stroke. She knew that she was probably having a stroke, but did not want to go to the hospital because she was terrified she'd go there and get the doom and die. So she died.
And so she died.
To get the treatment. So she died.
She was
anyway.
terrified of dying, and so she died.
Exactly. There's so many misdiagnoses. Or because people aren't going to get their cancer screenings and stuff.
Yeah,
and
I
the
wonder.
hospitals themselves are, their governance anyway, are playing into this. I heard on the radio 2 days ago, they said in Pennsylvania, don't go to the hospital. We're expecting there to be overwhelmed again with the second wave. The second
Don't
wave
go
is
to
gonna
the
be
hospital.
coming upon us soon. So stay away from the
Stay
hospital.
away
if you
from the
can.
hospital. But I can't feel my right side.
Yeah,
But I
doesn't
can't
matter.
feel my right side. Well, but you don't want to get the COVID. It sounds like you may be having some neurological problems, but just rest, right? Because you don't want to get the COVID. I wonder how many melanomas went undiagnosed during the previous 6 months. How many
We have
people?
some estimate of that, but that's going to take a couple of years to get those. This is the benefit they have. They can do all this stuff now, and by the time we discover all these numbers, because we need the data and we need time to get that data. Although we have some preliminary. The CDC also has preliminary estimates. It looks like at least from the CDC preliminary estimates, 20 to 30,000 deaths caused by the reaction, not by the coronavirus itself, but caused by the reaction
Of governments to the corona.
The government's action. So, yes, you'll hear a lot of people say, well, our business is down this year because of the coronavirus or so on. No, it's not because of the coronavirus. It's because of the government actions to the coronavirus.
Yes.
The government the coronavirus itself is not causing anything. It's causing some people at the end of their lives to make a slightly early exit. That's true. But these people are not, in general, working class. I mean, they're not out there working at this point in their lives. And so it's had very little effect on the economy as far as that goes. And I don't want to sound cold and callous when we talk about the economy. In the book, we say, look, the economy means food. The economy is how you get your dinner.
Yes.
All right? It's how you feed yourself. It's how you clothe your family. It's how you house yourself. So
The economy is us interacting with each other. That's all it is. And it's extremely important since we are social animals. We're not hunter-gatherers, and we have an economy. And if that economy can't function, then it comes out of our asses. It just does. That's it. You cannot restrict human behavior to things that the government likes, because the governments are notoriously inept at analyzing data, as you have seen. And when governments try to start micromanaging economies, what you get is Venezuela. Okay? You get Venezuela, and nobody wants to be in Venezuela. Certainly not me. Right? Now, the death data, I get the impression that the death data are so skewed in the direction of being useful to the government, and that the methods by which they have skewed it are so insidious that the death data it doesn't tell us a damn thing, really, does it?
Well,
what are the mechanisms by which these people are screwing this data up?
The whole dying with versus dying of is the biggest thing.
Right.
I mean, if you have it on your desk, if you have it in your system, this is also causing increase in hospitalizations. Because if you go in there to have your toe fungus scraped off and they give you the coronavirus test, you're going to be listed
as a case.
Coronavirus. Exactly. So they're it's all these protocols. You got to understand, people. It's difficult to describe, but hospitals develop these protocols, which are more or less fixed procedures that have to be followed, especially when you get all the government involved in these kinds of things. So someone comes in, now they all get the test. And if it's positive, regardless of whether it's an infection or not, you're sent into some kind of a pipeline, all right? And so you get repeated tests and all this kind of stuff. So backing out the numbers of real infections, real deaths, real hospitalizations of this thing, it's going to be difficult, and it's going to have to be done on a hospital-by-hospital basis long after all this stuff is over.
It's almost as though it's almost as though they designed it that way, Briggs. A cynical person would say that this whole system has been designed to manufacture a big number. And, the interesting thing about that number is that even with their best efforts, they've only been able to come up with 220,000 people as of when we're talking today that are dead from the coronavirus, as they say. We know it's 6% of that. But 220,000 that's a big number. That's a 6-digit number. That's like twice the population of Wichita Falls. That's a whole bunch of dead people, right? That's a lot of dead people.
Yeah.
And because people do not understand numbers. The general population is effectively innumerate. They don't understand the effect of numbers. 220,000 is what percentage of a population of 330 million?
Exactly.
It's far less than 1%, and
exactly.
It's you have to look at it.
We have 50, 60,000 people dying every week of other causes.
Right.
And so this is still minuscule, and it's gone down. It's gone down. I just posted the latest CDC numbers yesterday. It's decreasing, except for a caveat, which we have to talk about, the disappearing flu. We have to warn people about this.
That is an interesting problem. Yes, let's talk about that.
It's been decreasing steadily. There's no reason to reinvigorate this panic right now, except political reasons.
Right.
Because they're panicked because of all this increasing testing. The election's coming up. It's a curiosity that it's only these so-called blue states that are getting everybody back into lockdown mode, trying to make them nervous about going out and mixing the populations and vote and so forth.
That may backfire.
So much, but, right.
That might backfire.
They're doing it. So we do have to talk about this disappearing flu.
Yeah.
Now, I'm warning people for about a month. I got suspicious because the CDC has all kinds of data. They collected this weekly data for years. Every week, how many people die of the flu, how many die of pneumonia, how many die from all these other causes. And 3 or 4 weeks ago, they stopped collecting it in their normal manner. It disappeared.
I saw that announcement that said that this year the CDC will not be collecting flu death data.
Yes.
What?
And not just them. I have some numbers up if people want to go and see it. My website from the WHO, the World Health Organization. They have a global flu tracking system, and they've been running this for years too. And it makes sense to do this because you want to know what strains of the flu are being passed around. There's about 8 strains that they check.
Right, so that you can formulate the vaccine correctly.
Exactly. So exactly, but it does. Of course, that vaccine's a whole other question. We'll leave aside.
Yeah, it's
now since the past about 3 months, there's been it hasn't dropped to exactly 0. But in the single digits, there's no flu being reported from any of these agencies. Flu has, in essence, disappeared. It's disappeared. They did last week. I think they did 3,000 or 4,000 tests. The CDC reported, of which only they found 1 positive. One. This was just last week. It's nuts.
What in the hell explains that?
Here's what the problem is. Flu is not going away.
Of course
you're
not.
Not going to get bug as in the coronavirus isn't battling with the flu virus and winning it. That's just not what happens. What's happening is they've forgotten to test for it. You go into the hospital now, they're not going to test you for flu. If you got shortness of breath and all this they're going to test you for the coronadoom.
Because flu test doesn't make them any money.
Sensitive. You're going to get a lot of positives for people who are having flu. And that doesn't, okay, so what? They're still getting treated and all this kind of stuff. But there's 2 dangers. The first is they're going to use the ordinary flu numbers and their ineptitude to continue to juice this panic. In other words, the natural flu numbers, which just start rising at this point in time every year, are going to be mistaken for the coronavirus numbers in a lot of instances. And we're going to say, oh, my God, look what's happening. And because of that, they're going to start saying something like this. You guys listen for this. Okay, you heard it here first. They're going to say, oh, no, now the coronavirus is attacking the young. We've had more young people dying all of a sudden from the coronavirus, they're going to say, because the flu does kill the young.
Right.
The flu is a very deadly disease in the young, so it's something to watch out for in kids. But because of these mistakes, that's a prediction. I'm not saying it's going to happen everywhere or it's planned or anything like this, but we have so much ineptitude, so much self-blindness and confirmation bias going on that's going to happen. It'll get straightened out eventually, but not until after it's caused tremendous harm.
Briggs, the hospital's getting paid for COVID-19 tests, and they're not getting paid for flu tests.
Well, that
now,
depends
I mean,
on the locality, municipality, depends on because every state has their own, and metropolitan area has different flu reporting guidelines and criteria and so forth. So that's complicated. However, what seems to be absolutely positively clear is they're just not making the tests.
They're just not doing it.
They're opting for the COVID test or the coronavirus test instead.
Well, that's fascinating. I have heard that a positive coronavirus test in a hospital situation is worth about $19,000 to the hospital. And I've also heard that a coronavirus ICU admission is worth $39,000 to the hospital. Now, if you've got the flu and you've got COVID-19, and I only test you for COVID-19, then I don't get a positive flu test, and I do get either $20,000 or $40,000. Could that be skewing this data?
So it's probably not absolutely. It's absolutely an extreme possibility. It's not that the doctors are doing it, you understand. They're still treating these patients.
It's the hospital administrators.
Following their protocols, and they're saying, okay, did the test come up positive for the doom? And yes, they put it into their system. And then later down the line where the administrators get hold of this data, and it comes billing time and all that kind of stuff, that's where the magic happens.
Right.
Okay? So that it's not a simple kind of a thing, but it's obviously political. All right,
right.
It's extremely political, and I must sound like a raving lunatic to your audience because
any sane person at this point does, Briggs. Any sane person sounds like a raving lunatic right now.
we threw away everything we knew about viruses and epidemiology starting in 2020, that I can't believe people who know better are starting to say the most idiotic things they know can't be right. These are responsible people connected with government who heretofore had made somewhat sensible statements, and now they're siding with the panic side of the equation no matter what happens.
They have suddenly agreed to be irresponsible, haven't they?
That's it.
Yeah.
That's exactly what it is. It's this look, you have to make decisions. That's understandable. But every time you bring up the decisions other countries have made, and these facts about epidemiology or just viruses in general, they somehow become deaf and blind. You point to Sweden. Everybody points to Sweden. Sweden, of course, famously did not have a lockdown. They did not have mask mandates, and they did fine. They're probably at herd immunity now. They haven't had any deaths or one or two deaths. They haven't been testing like mad.
Right.
Okay. So
and you could still go get lunch, can't you?
You could still go get. Everything is open. I mean, they had a few minor. If we just had what Sweden had, nobody would have said a word. I mean, we would have just,
right.
Whatever. Japan did even better. They did about 10 times as good as Sweden, and they didn't have a lockdown. But we somehow don't hear about Japan. They got a population that's much, much larger than Sweden's. Why don't we hear about Japan? We don't hear about Taiwan. Taiwan did fine. They got like 30 million people, many more than Sweden. They had 8 deaths. 8. No lockdown. Yeah, 8 coronavirus deaths. Oh, they also not testing like crazy. They didn't freak out. There's many countries like this, okay? And you ask our government officials, what about Sweden? What about Japan? What about Taiwan? What about Vietnam? What about these countries that all did fine and didn't do what we're doing? And they say, what are you trying to do? Kill people?
Yeah.
And so they come up with something.
No, I'm trying to ask you a reasonable question, and you won't answer it because it doesn't suit your agenda.
That's exactly what it is.
Yes.
Because it's this zero tolerance policy. Because our politicians have figured that every death that occurs is going to be blamed on somebody, not the virus. It's going to be blamed on some person, because this life could have been saved if somebody had done something.
Right.
That's our whole country. We've been sliding into that for years.
That's been the habit of a politician. Somebody's got to do something, even if it doesn't make any fucking sense.
So they can say that they did. Now, if
Right.
it happens, they'll say, I did everything in my power to stop it. They don't care about you. They don't care about the citizens. They care about their own reputation.
That's right.
They care about their own career, their own riches. They're self-aggrandizing SOBs, a lot of these guys, and they're just doing this because for themselves alone, when they should know better. And
Right.
that's why I get so riled up about all this kind of stuff, because to throw away everything we have known for 100 years to do this is, it's upsetting.
Well, let's get you even more riled up and talk about masks. Masks are an interesting phenomenon. I'm assuming that mask manufacturers are doing pretty well these days. We just got back from Denver and a seminar in Denver, and the damnedest thing we noticed up there is there was essentially 100% mask compliance. Now, you don't see that here in North Texas. There's a bunch of people wearing them, but there's probably, 10-15% of us are walking around without any masks, and nobody says a word to us. It's just they don't. I have yet to have anybody say anything to me, to my face, about this. In contrast, I tend to laugh at especially men who are wearing masks, and because of what we're about to discuss. That I know and they apparently don't know. And I tend to laugh at them. And when I do laugh at them, I look right at them and laugh at them. And you know what they do? They avert their eyes. That's what they do. They turn their eyes. Because they know they're being stupid and afraid. They're afraid. And they're just doing as they're told. A mask is a badge of obedience for you people. Now, if you people that are watching this podcast have not investigated what masks can and cannot do, and you're wearing one anyway, then you are being intellectually lazy. Because what you think a mask is doing is not what a mask is doing. And yet, this mass hysteria has gripped society all over the world, and everyone is wearing the mask. Just wear the damn mask, right? How about no? No, I'm not going to wear the mask. And Briggs knows about masks. You know, he's written about this before. And let's talk about this right now because I think it's terribly important. There are some people who really honestly believe that they need to wear a mask. But what does a mask do? What does a mask not do? And what are the studies that show that masks don't do anything, being what's happening to those studies?
Yeah. So, first of all, you're absolutely right about these people. A lot of the guys are out there, they're wearing this stuff. They're not scared of catching the bug, but they're scared of not fitting in.
You and I don't mind being thought of as assholes. Okay?
No,
that's the fact. And the fact is that what we are perceived as, we walk into a store and we don't have a mask on, everybody else in the store looks at us and says, "Look at that asshole." I don't care.
Yep.
I don't care. You don't care. But lots and lots and lots of people do care about being, not that they're afraid, but that you're supposed to wear the mask, and the mask might as well have a sign on the front of it that says, "I do what I'm told." And that's what the mask is. It's a symbol of obedience. It's not a public health measure.
And it's become a political question too.
In fact.
So here's the thing. Look, I'll sound like Joe Biden for a second. Here's the thing. Come on, man. It's not like scientists have never thought about maybe do masks even work? Have they ever studied this before? It's like it's a brand new question.
Yeah. Dentists have been wearing masks for decades. People in the hospital have been wearing masks for decades. I mean, since the germ theory of disease was first articulated, people have been wearing masks because there's a reason to do it under some circumstances. Rare circumstances.
And they have to, and there's special circumstances. We'll talk about that. 100 years ago, the Spanish flu hit the world, as most people know, killed maybe up to 50 million people. Estimates vary. It's not like we haven't thought about this question before. We actually had, in some areas of the country back then, mask mandates, like
yes.
in San Francisco and I think Philly, and a couple of other places. People were being chased down by the cops for flaunting that law back then too. But there were immediate studies done right after it. And there's a paper, I have it linked on my site. The guys looked at the infection rate of the people who wore a mask and didn't wear a mask, and said, I guess we discovered that masks don't have any utility. And so that wasn't the first study that found that mask
right.
in the general mask usage in the general public, the slowest spread, don't work. There's a big paper that came out in March or May, I forget what, this year. It's called a meta-analysis. And what this is a compilation of other studies that have studied a similar thing. So this guy named Xiao and a bunch of other people listed 14 different studies that had looked at the efficiency of masks at stopping the spread of viruses. And they discovered,
not coronavirus, but various other viruses.
Any
yes.
kind of these
right. Respiratory diseases, right?
And they discovered doesn't work. It's just as good as wearing no mask whatsoever. So and that's not the only. There's dozens of other studies that have looked at the same thing. At the very best, it's ambiguous, but most papers say no, it doesn't work. And not only that. There's a study that came out in 2015 in the British Medical Journal. They looked at people who were infecting themselves through the use of masks. They looked at cloth masks, these homemade masks that a lot of people favor, the black ones, because I don't know why people are always switching to these black ones. Maybe they think it looks sexy.
Because they're badass, man. Bad with a skull on it. That's what you want. It's a mask with a skull or teeth or something, you know.
These cloth masks, what they did is they looked and they discovered, the people wearing these were recirculating the viruses back. The virus got in all right because there's a vapor shield when you're breathing on the inside, and the viruses that you might have breathed right back out are trapped in there, and you're reinfecting yourselves, not just with the coronavirus, but other viruses as well.
And with bacteria as well.
There's staph, there's acne, there's other kinds of diseases. But so you bring this stuff up to people who are mandating the mask, and what do they say? You're a criminal if you don't wear a mask. That's what they say. You're going to have to pay a fine. It's a crime, a misdemeanor, like it is for stealing or I don't even know, all the simple assault or something like this. Not wearing a mask is now a crime, even though we have all of this evidence that say masks in the general public don't work. Now, where do masks work? Well, a surgeon has a very special kind of mask that the surgeon is extremely careful not to touch during his surgery. That mask is to prevent him from snotting into the patient or from particles of fluid, blood and whatnot, getting up into his system. That's what that mask does. All right?
Yes.
That's all it does.
That's in the OR.
You wear these crappy little masks either the cloth mask, which are terrible, or you wear these paper things that are the biggest sellers because they're cheap, and you got to follow these laws, people think. I don't. But you put them on, no one wears them perfectly properly. And they say right on the box, this has been pointed out dozens of times too, they say right on the box, not designed to prevent transmission of any disease.
Right.
But it doesn't matter.
But you're having to wear them to prevent transmission of any disease. Even though the box says it doesn't do that, but you have to do it anyway because you are expected to obey.
Now, even the fabulous Fauci was out back in March saying, don't wear masks. It's silly for people in the United States to wear masks. This is not going to work.
That's the last correct thing he said.
Now he's saying you're going to have to wear a mask till 2022, the end of 2022. And he also said, no handshakes forever. We're going to have to stop shaking hands forever. This is science. This guy is a gross opportunist who flip-flops more than I can imagine. He
God.
rides the wind. Whatever he thinks the public wants to hear, he's out there saying. And somehow we're only supposed to listen to him and no other doctors, no other medical professionals.
Briggs, do you remember back in the late 90s? Back in the late 90s when the vaunted Dr. Anthony Fauci told everybody that would listen to him that by 1992, AIDS would affect 22 million people in the general population. I clearly remember that. I was a young man, and I was extremely concerned about this because of my activities at the time, and it was on everyone's mind. Here is this guy who is apparently an expert on disease transmission telling us that everybody was going to fucking die. And 89 came around, and 90 came around, and 91, and 92, and everybody's not dead. And at no point did Anthony Fauci call a press conference and say, I was wrong about that. It just went away. And every single time this guy opens his mouth about anything, I am reminded of that period in American history when Anthony Fauci attempted to manipulate the behavior of the population of the United States. Now, what is this guy? How does he get off on this? That's a lot of power. And I think the man is evil, and I think he just wants to. It would not surprise me if Anthony Fauci issued a directive. You know what everybody needs to do? Every morning, what you need to do before you leave for work, what you need to do is let all the air out of the tires of your car and air them back up. And you have to do this because it's for your own safety, because the tires work better and you won't have a wreck. So I want everybody right now to go out and let all the air out of their tires and then air them back up. Now, that's going to mean, of course, that you have to have a compressor. And we recommend the brand of, what's that brand they sell at Lowe's? Something Cable. He'll have a sponsor, see, of the brand of compressor he wants you to buy. But you've got nothing would surprise me. Nothing would surprise me. These people are marketing bullshit. They are bullshit salesmen. And he doesn't have the slightest idea what the hell he's talking about. And I'm telling you, epidemiologists, like climate scientists,
Yep.
we should call them modelists because they're not scientists. They're not scientists.
You know more of what you speak when you say that than
Yes,
anything
sir.
else. That is an excellent summary of exactly what's going on.
Yes.
Now, of course, with AIDS, that just like the Corona doom was very political. Back
Yes.
then, you remember, they said everybody had a chance of getting it because to say that only certain risky behaviors
Right.
could spread this was politically incorrect.
Oh yes, it was. That
They
was
had to say
the
everybody was going to get it.
that
And
was
of course,
the dawn of the
there was a huge frightened panic scare about that. Too.
right.
Absolutely everywhere. People, remember the water faucets they shut off in the schools and things like this because they didn't want you to touch the water faucets
Because of AIDS.
So it happened.
Yeah.
It happened.
Oh, I remember. Yes, it was.
Yeah.
This is absolute insanity. You know.
They've forgotten that, but we go through these phases, and this is just as political. But when you say modelers, that's exactly right. That's a brilliant phrase, which I'm going to steal.
Modelists. They're modelists. They're not scientists. They're modelists. They put together. All these people have put together this bullshit model. It's a mathematical model. It wouldn't even be possible unless we had computers, because you couldn't have put the model together back in the 1920s because there wasn't any way to run the model. But now that we have computers and we put together these bullshit models without any concern for the fact that all of these systems are so thoroughly multivariate that you don't, not only do you not have all of the variables accounted for, but you don't know what all of the variables are. And yet you run these models and public policies being made on the basis of an incomplete model that never, ever predicts anything. They never predict anything correctly.
They don't predict accurately. Yes. Let me tell you, this is brilliant. This is brilliant because there's two things here. One was England's got their own Fauci by the name of Andrew Ferguson,
Yes.
who is a modelist.
Neil Ferguson. Neil Ferguson.
Neil Ferguson. Yes.
Neil Ferguson. Let's not get his name wrong. We wouldn't want to be wrong like he was.
Poor friend, we get his name wrong. This guy.
Yeah.
He has made so many mistakes. We go through in the book every one of them, every single panic from the mad cow disease, the bird flu, the swine
Oh God,
flu.
he was responsible for the BSE thing. Oh my God.
Man, it was his models that predicted tens of thousands, hundreds of thousands of deaths for each of these diseases.
Right.
And it was his model that drove the initial panic to the coronavirus. He had in his model, he didn't even recognize it. He didn't even recognize it because of the way they spit the model out. And it's complicated technical kind of details, which I won't say. But in essence, it said more people are going to die of the coronavirus by the middle of this year. They were having, in America, 150,000 people die a day. They said 2 million dead in the United States. That's a lot of people. How do you get 2 million people a day? Well, you're going to have tens of thousands dying every day. Right?
Every single day.
Think about it. They just stuck this in their model. Now, last week, the New York Times was touting this new study that said, look, it's a Nature magazine. Oh, well, stand back. It says a new model proves masks work. Now, I'm going to let all your listeners in on a secret, which I think, Mark, you already know. No model does anything except what it's told. And I'll rephrase it. Every model says exactly what it is told to say. So what these guys did in their mask model is they built a model that predicted the number of deaths, and they ran that forward. And then they said, I'm going to assume that masks work. And then they repredicted the number of deaths, which were lower. And then they looked and said, look, masks work because the number of dead are lower. And it's reported as a discovery. It's reported as a discovery that masks work because the number of deaths are lower. But they started with that opinion.
Yes.
This is every model that you ever, it's even the good models, all models only say what they're told to say. A good model makes good predictions, predicts accurately, but it does exactly what it's told. A bad model also does what it's told and makes horrible predictions. But I say, you can't be fired for being wrong in the right direction. All of these modelists are wrong in the right direction. They're in what I mean by the right direction is they're in the direction that the government wants to hear.
Because that's who's paying their salaries.
That is necessary. Absolutely.
Yes. That's who's paying for them. And if you do what you're told, you generate data that show what we want it to say, you be a good boy and a good girl and wear your masks, then everything will be just fine. Right? I don't know, man. We're in a situation here that makes Alex Jones look not so fucking crazy. No. We are in a situation here where a cynical person might say, what I'm seeing here is like evidence for the New World Order and the Bilderbergers and the Trilateral Commission and the various conspiracy theories, because had this situation been in operation only in the United States, you might be able to say, yeah, the CDC fucked this thing up. Anthony Fauci fucked this thing up. And had it just been the United States and the UK, yeah, Neil Ferguson fucked this up and Anthony Fauci fucked this up. But everywhere in the world, the same mass hysteria is taking place. There is absolutely no reason to wear a mask under hardly any circumstance, certainly not in a grocery store. Certainly not riding your bicycle down the sidewalk by yourself in the sun. There's no reason why an 18-year-old girl is wearing a mask. She can't get sick. She can't transmit it to anybody. That's true. I mean, look at the data. This asymptomatic transmission thing, that's bullshit too. Yet everybody agrees that they're going to behave a certain way. Everyone agrees. People all over Europe, people all over Asia, people all over Africa, people in South America, everyone all over the world is behaving like a fool. People all over the world have decided to comply. They've decided to do as they are told. Because even if they have got some reservations about the logic of this behavior, about the science behind it, even if they know damn good and well that 16-year-old kids do not either transmit nor contract this disease, they're going to make their kids wear the mask. They're going to wear the mask themselves. It's a symbol of obedience. Now, a cynical person would say that this whole, over and above the disease statistics, because I don't know about you, but it occurred to me about 6 months ago that this was not about a virus. None of this is about a virus. This is about something else. And I don't know what the hell else, and I don't know who. I don't know why. And that's the most disturbing thing of all to me. So, honestly, do you think something else is going on here? Or do you think this is adequately explained by stupidity?
Stupidity is never to be discounted.
No.
But think of it this way. We all read these books like The Extraordinary Delusions, Madness of Crowds, things like this.
Right.
And we always read these examples where in the past people have gone insane. Mass groups of people have gone insane. We always laugh and think, isn't that silly? I would never make those mistakes.
Right.
But yet here we are in the midst of one of these panics. Now, what happened is we don't even need to have an active conspiracy per se. Not that I'm discounting that with the WHO and Chinese money or anything like that.
Right.
No. But we have people, two kinds of people of similar mindsets that are all playing off each other. The first is the regular public, and the public panic. And they spread this panic through the social media, which is now global and instantaneous.
Yes.
We document, too, at least 10 times, if not 100 times or more bigger phenomena than it was in 2009. Everybody carries around these free tracking devices, your cell phones, to let the government know where you are at all times. So we know what's going on. People are spreading every bit of news, and they were spreading everything instantly. Every new death that was reported initially, every new case, and everybody pasted them everywhere. And everybody talked about it, got themselves worked out into a tizzy. And they started believing this Chinese propaganda that came out. You see a guy walking down the street, and he collapses. Oh, my God, that's going to happen to us.
Right.
Do we ever have anybody walk down the street, have a heart attack, and die? Yeah, it happens.
It does occur.
So that stuff, that was one thing. The other is this the bureaucratic mindset, the management mindset, the people who were just itching for something to take control as much as they could. They knew they had this rabble under them, the deplorables, the people who didn't know quite what was good for them, but really didn't have a good hook to get them to do what we needed them to do. And now they have it with this.
Yes, they do.
And they look, the World Economic Forum just today tweeted out, here's what to do for meetings to stay happy in the second lockdown, or words to that effect. God. They have a picture of these two people enjoying their enslavement, grinning at the camera. The World Economic Forum. Now, what are they getting out of this? I mean, a lot of people,
that's an interesting question, isn't it?
What happened, it's indisputable. Now, is it planned or not? Indisputable. The big tech companies all made a ton of money off of this. Amazon got really wealthy. All these online businesses got wealthy. The middle class money is being sucked away. We've spent quite literally trillions with a T on this so far. And where's that money going to come from? It's got to come from somewhere. They don't have it collected now per se, but they got to get it eventually. So they're not hurting. Some of the people at the top are hurting, but the big oligarchs, the big tech, the big people who got all these things, they're doing fine. And, so do we need a conspiracy, or do we need similar mindsets? Yeah, I'm sure there's people are getting on the phone and talking to each other saying, here's what we got to do. It doesn't need to be backroom, deals, people wearing robes to be that kind of conspiracy, but can be all these people getting together and agreeing. I mean, that's why they just had up on Capitol Hill today, or was it yesterday? I think it was today, the Google guy and Twitter and Facebook being grilled about their censoring this. And this, like you said at the beginning, they might censor this. They have often censored. They've already censored some of our videos on this right now.
Sure.
You got this blue-haired hippo censor sitting behind a screen who thinks she knows anything about medicine. We can't have this possibly being out there because it's not science.
It's misinformation, do you see? It's misinformation. How she knows that remains to be seen.
It is a conspiracy in the sense that all these people think alike, and they can't be talked out of their unreasoning attitude. Mm-hmm. And so how do we get out of this? How do we get out of this panic? Because it seems we're determined now to go back into the second wave of the panic.
Goddamn, Briggs, I don't know, man. This is...
And it's got to be something else to distract us. How did we get out of the AIDS panic? It was just that time went on.
It just wore off, It just wore off. But there will be people, I get the impression that there will be people who, as a result of this, who for the rest of their lives, every time they leave their house, they'll do it with a mask on. That's my impression. I hope I'm wrong. but I don't know. I mean, you have to understand that, God, I hate to say this, but I've said it before, and I might as well go ahead and remind everybody. The average IQ in the United States is 105. That's just the case, all right? And people can't be expected to understand all of the things that we understand. People are scientifically illiterate. People are innumerate. And the poor things are being told by people they perceive to be in positions of authority that you're going to have to wear the mask. You'll wear the mask. Do it for other people. Do it for yourself. Wear the mask. How does the whole of society fight that off?
We got to do it one person at a time. One person at a time. Say, look, just calm yourself. Look it up. Look at the number of actual deaths every day. See, they've gone to zero. What are you worried about? Don't listen to the media.
Yeah, but the cases. The cases.
The media lies to us now,
yes.
By now. I mean, the media, haven't we learned from 2016, at least until now, that the media is a very interested source pushing their own line, and it's beyond imagination that we don't know how to deal with the media at this point. But yet you're right. There's a lot of people who slavishly follow it, and all they know is what they get from their television. That's it.
That's it.
And they believe it.
And they believe every syllable of what they're told. Do you realize this is the damnedest thing I've ever seen? This is how bad the media is. Amy Coney Barrett was confirmed last Monday night. Did you know that NBC News did not mention that as a part of their newscast? A confirmation of a new Supreme Court justice was omitted from the newscast on NBC.
That's exactly an excellent point. There's two kinds of lies, right? Commission and omission. And
yes.
Their biggest lies are by far omission.
Omission.
They leave out any possible good news, anything
yes.
that they perceive the other side is going to use for their benefit, the side of truth and reality.
Right.
So,
right. The actual death rate. I've been using a statistic for 6 months now that I just invented because I didn't see it anywhere else, that the rate of death of COVID-19 in a population group, right? What is the population of the state of Texas? It's 29 million or whatever. And how many people in the state of Texas have died of COVID-19? And do that little division and come up with a percent of the population of Texas that's died of COVID-19. And it's always it's 0 point, a bunch of zeros and 3, right? Now, to you and I, that means important things. But people don't understand those numbers. People don't understand those numbers, and the media take advantage of the fact that people don't understand those numbers. And they lie to us by omission. They lie to us by omission is what they're doing. And, I can't say enough bad shit about the media. You may think that the politics of this country are all fucked up right now, and I would freely admit that they are, but how did they get that way? With the media. The media created the problem. They created the problem.
That's exactly right. They leave out whatever they don't want you to hear.
Yeah.
And it didn't happen. It just didn't happen.
It's like it didn't happen.
The number of deaths, they'll tell you the number of coronavirus deaths, and that's all they'll tell you. They don't tell you that 10 to 600 times more people died of other things.
Right.
It just doesn't appear.
And then they'll just omit the fact that people aren't dying anymore, and they'll talk about cases. The case rate is spiking. The case rate is spiking. No, the testing rate is spiking. But try to explain that to somebody. It's hard for them to understand, the poor little things, and you manufacture cases with testing. Testing saves lives. You say that enough, and they'll just, I guess it does. testing. You want to know, you want to know things, and knowing things is good, right?
I get yelled at all the time on Twitter, on the blog. What you're trying to kill people, Briggs? What are you doing? I mean, I know that this is, they don't know what they're talking about, and I feel sorry for these people. They just buy into this stuff, and they get so angry when they meet a dissenting voice, as if I'm in power. I have no power. I have no authority. I'm a one-man shop. I'm in charge of nobody or nothing. I can't make any decisions for anybody. And all I try to do is tell you, here's what I see the official numbers are saying. All right? And even that is deemed to be censorable.
Well, or murderous.
Yeah.
You're murdering people by telling them the truth. Yeah. Right. Well, now, isn't that an interesting situation to be in, where the truth murders people?
Right. Interesting.
It's an interesting situation.
I get so upset about it. I wave my arms around and scream like an idiot because I don't know how to get this across to people that they don't need to be panicking. Just calm yourselves. Look at your I tell you what, maybe this is a good exercise for people. Look at yourself. Look at the people to the left of you and to the right of you, your family. Everything okay? Everybody seem to be okay? Don't listen to friend of a friend stories and everything, but doesn't it look okay right about where you are?
Right.
And then have other, confirm it that way, one thing at a time. It's not that bad. It's not that bad.
Eventually it will soak in that, look, there aren't piles of bodies. We were told there'd be piles of bodies. There are no piles of bodies. All right? Most people in the United States don't know anybody that's died of COVID-19. Most people don't know anyone personally that have died of COVID-19 because not that many have. Now, back in 1918, everybody knew somebody that was dead of the Spanish flu. Everybody. Because that was a pandemic. This is not. This is the flu. It's not the flu, but it's the flu, if you understand what I mean. And podcasts like this, all we can do is just tell you. All we can do is tell you the truth and ask you to please stop talking and think for a minute. When you start babbling nonsense about everybody, the case rate, and people are dying and all this other shit that you don't know anything about, stop talking, learn, rethink your actions, calm down, take off the mask, have a normal relationship with the people around you, get back to work, don't be afraid all the time, and have a ball or two about you, okay? Have some courage to be thought of as an asshole if that's what's necessary. Believe me, I know it's not the end of the world. So, Briggs, I sure do appreciate you being with us today. We'll talk again before it's over with, and I want to thank you for making the time to be with us. And you guys, here's the book, Amazon.com, The Price of Panic. It's timely. It's important. Buy it. Thank you, sir. Appreciate your being here.
Thank you for putting up with my ravings.
No, you may have noticed that I'm raving harder than you are. All right.
I really do appreciate it.
Sure, Briggs. Thank you much.
Get the word out.
Absolutely. And we'll see you next week, Starting Strength Radio.